sector in the country has been calling for pool testing to help minimize the government's COVID-19 costs and help test more people. Authorities have yet to approve the implementing rules. We find out more from former Health Secretary and Iloilo Representative Janette Garin, and she joins us tonight on The Final Word. Congresswoman, thank you so much for joining us on the program. Please share with us, how does this pool testing work?
Thank you very much, Rico. The pool testing is actually the game changer, where we will be able to coexist with COVID. This is a joint collaboration of the Research Institute of Tropical Medicine, the Philippine Children's Medical Center, the Philippine Society of Pathologists, Go Negosyo, and the BDO Foundation. The intention of which is to immediately test a certain cluster of population. You swab all individuals individually with their individual viral transport media, and depending on the outcome, we are seeing a very good, promising results on pools of 5s and pools of 10s. We are validating pools of 20s and possibly pools of 25s. But for now, we are awaiting the final outcome of the research by next week. This will optimize the kits, reduce the workload. Imagine a laboratory with a capacity of 1,000 will now have a capacity of 10,000 per day at a highly reduced cost. Go Negosyo was very successful in reducing the cost of PCR swab testing to around 1,800 pesos. So now the proposed pool testing will reduce that further to 350 pesos.
So a lot of savings and short turnaround time. So as you say, Congresswoman, it is a game changer. When do you expect the rollout of this pool testing? And when will it be approved by the Department of Health?
We intend to relay the initial results to the Department of Health immediately after the SONA. So that would be by the first week of August. God willing, if the DOH will allow us to immediately cascade it to 20 laboratories, then 20 hospitals will be able to do pool testing by middle of August. And then moving forward, that can still be cascaded all over the country. That will allow us a granular lockdown. We don't have to lock down a whole and big areas and big islands, or even the whole of Metro Manila. We can do massive expanded testing of vulnerables, asymptomatic vulnerables, while at the same time, we bring back the confidence of our people in going back to work.
Is it as sensitive, Congresswoman, as RT-PCR testing, which the DOH says is the gold standard?
Yes, this is precisely the reason why a research was conducted by PSP, Go Negosyo, and RITM, because we want to maintain the accuracy at least 90%. We're aiming for 95%. And the cycle threshold, it's quite a medical, it's a medical terminology, but what it simply says is that any pools generated will not affect the accuracy of the kit. Bottom line, whatever is its performance for individual PCR swab test will be the same for the recommended pool.
And Congresswoman, we have President Rodrigo Duterte delivering his 5th SONA this coming Monday. Personally, what would you like to hear from the President in terms of priorities in fighting this COVID-19 infection?
We need to see where the enemies are hiding and lurking. This is the fight where we can see the enemy. If we have the President's word that we expand testing via pool testing mechanism, then whatever budget we have will be tantamount to testing maybe 50 million Filipinos, and that's half of our population.
And
then that will allow health and economy to meet halfway.
Absolutely. That is the priority right now, health and the economy. But in terms of the universal healthcare law, Congresswoman, are we likely to see its implementation sooner rather than later?
It will be very difficult to say. The pandemic has brought a lot of out-of-pocket expenditures, not only related to COVID, but even to non-COVID illnesses. Like patients who are on dialysis or on chemotherapeutic treatments have to source out and to pay for PPEs. The cost of healthcare has gone so high, it will really affect the implementation of universal healthcare. But if with the massive testing, immediate isolation, no home quarantine, we will be able to catch up and implement universal healthcare, although it will be a little bit late.
former Health Secretary and currently Iloilo Representative Janette Garin. Thank you so much for joining us on The Final Word. And we'll